Assalamu alaikum. This is Dr. Tabriz. Today is April 11th, 2020. First of all, I would like to thank Dar-us-Sunnah community for giving me the opportunity to talk to you about these important topics of COVID-19. Those who don't know me, I would like to introduce myself. I'm an infectious disease specialist and have been in practice for more than 17 years. I am also Associate Professor of Medicine at University of Illinois, Chicago. Many of you have many questions in regards to COVID-19, and that's why we decided to put together this short video for informative purpose. In last month, I have seen many cases, probably more than 50 to 60 confirmed cases in the hospital. Many of them had mild symptoms and improved and went home. However, some of them became very seriously ill, and some of them actually ended up in the intensive care unit. So I would like to share my experience so that you can help yourself, your family, and the community to protect from this serious infection. So what is COVID-19? COVID-19 is the name of the disease. It stands for COVID or coronavirus disease. The virus that caused this infection is called SARS coronavirus 2. We all get common cold. Every year we have common cold. This common cold usually caused by other coronavirus. Those are called human coronavirus. This particular SARS coronavirus is a novel coronavirus. It started probably from an animal, likely a bat, and then jumped to human. And as you know, first case was in Wuhan, China in December, and since then it spread all over the world. So the common cold is a coronavirus. This is also a coronavirus, and it causes respiratory tract infection like any other respiratory viruses, including common corona as well as flu. Then why is it so serious? I would like to divide it in two parts. This virus is so serious because, number one, it spreads very efficiently because it is a new virus. Human body does not recognize this virus, so they get symptomatic and sometimes even asymptomatic, and other humans are also not exposed to the virus, so the virus can spread very quickly. And also, the virus spread to the respiratory tract, means through the cough and sneezing, and as opposed to other viruses where it spreads through, for example, food or mosquito or blood, this is very easy to spread. The second part is this is more serious because in common cold, you don't have serious illness. In flu, most of the time, you don't get serious illness. But because this is a new virus, it infects the upper respiratory tract first, means your throat and nose, and then eventually some of us will get infection in the lung and cause serious disease and pneumonia and can cause fatal outcome. As these cases can spread very quickly in a short period of time, many of the patients can end up in the hospital, and the hospital may get actually overcrowded and not able to take care of many patients at a time, including if some of them require more critical care service. So that's why it is so serious, and it is important to contain as much as we can. So how do you get COVID-19 and how does it spread? The respiratory virus, as this COVID-19 is a respiratory virus infection, in general spread two different ways. One is called droplet, the other one is called contact. Let me explain what does it mean. If somebody is infected with COVID-19 virus, when they cough, they generate a lot of small tiny particles in their secretion. These tiny particles has many viruses. So these tiny particles are called droplet. In general, they travel up to 3 to 6 feet. If another person who is not infected are within that 3 to 6 feet when somebody is coughing, basically they are then breathing these infected tiny particles and getting infected. However, the more important and more common way of spreading the infection or getting the infection is probably would be through contact. Means you can have direct contact with the infected person or indirect contact through some other objects. To give an example, if the infected person, when they cough, they are not covering their mouth and nose and touching with their hand, the virus then can infect their hand, and through this hand they can then contaminate other surfaces including doorknobs, faucets, countertop, or anything they have touched. That's one way. The other way also, if this cough and respiratory secretion is not covered, those droplet actually can travel up to 3 to 6 feet and falls onto the different surfaces directly. Means it could be on the tabletop, in a public place, it could be in different surfaces in grocery store, and at home even. And when somebody else who is not infected now touching those surfaces, means tables, faucets, countertops, phones, or for example, television remote control that many people use the same remote, and then they are touching their nose and eyes, then they can get this infection. So the important point here is just because you touched some of this contaminated surface doesn't mean that you are going to be infected. You're going to get the infection once you touch your own nose and eyes with this your own contaminated hand after you touched all those contaminated surface. So that's how you can get the infection and spread the infection, by direct contact with a cough or indirect contact through this all tiny particles through the surfaces and objects that many people touches. Now the question comes, many people ask, is the virus is in the air that you can just breathe and get infected? The short answer to this is no. The reason is, as I explained, when somebody coughs, these viruses in tiny particles drops within 3 to 6 feet within very short period of time. It does not float into the air for too long. So just walking into a open place and even at your household, it's not going to cause any infection just breathing through the air. Now that we talked about how do you get the infection and how the infection is spread, we need to talk about what we can do to prevent from getting the infection as well as to prevent spreading the infection. So, as you already know, the infection is established in the community, means it's out there. And as of today, in US, we have about 525,000 cases and almost 20,000 fatality in US only in about last 1 month. So there are many things we can do to protect ourselves as well as protect others. At this point, the most important thing all of us should do is stay home. Means if you don't have any urgency or emergency, you should be staying home. When I say stay home, it's actually staying home. It's not even small community gathering that you need to go out and do something like that. That will help prevent spreading this infection to others as well as it will keep you safe. Now, obviously, we all have to go out and live our life. We need to be cautious, but not panic. There is nothing to be panicking here. You need to go to, for example, grocery or sometimes pharmacy or other important thing that you need to take care of. or maybe the gas station. So obviously there's certain basic thing you can do to protect yourself and protect your family. As I said, the infection is spread through cough and through contact if you're touching a contaminated surface. So if you're going to a public place like a grocery store or pharmacy or so on, make sure that you keep your hand within yourself. Means whatever you're touching, don't touch face, nose, or anything during that time. And after you come to your car or home, first thing you need to do is wash your hand or sanitize your hand. In a few minutes, I'm going to demonstrate how to sanitize your hand properly. Same thing, at this point, we are recommending, the government and CDC has recommended everybody should wear a regular mask. This is not a surgical mask or medical mask. This is just a regular homemade mask. I would like to explain here this homemade mask that are recommended for you to wear when you go out is not actually to protect yourself from getting the infection. Because the homemade mask is not designed or doesn't have the filtration capability to protect the virus to come to your airway. This is particularly important, or this is recommended in case any of you have the virus, so that you don't spread to others by containing your secretion within yourself. So that's important. By wearing the regular mask, you should not be getting a false sense of security that you are now protected. You still need to practice the hand hygiene. Means when you are going out, in case you touch a contaminated surface in the grocery store or pharmacy or gas station when you're pumping the gas in your car, your hand is considered contaminated. So make sure you don't touch the mask that you are wearing, because when you touch the mask, you can contaminate this mask and then you can bring the infection to home. So there has to be a proper way of taking off the mask also, which we'll talk about it again. So the other thing is, if you are sick, means you have cough or any other symptom, whether you have all the symptoms of COVID or not, you should consider yourself, you might have it. And in that case, you may have to, quarantine yourself at your home in a particular room. About the symptoms and signs and when you need to call and what to do, we'll talk about in a few minutes. I'm just talking your regular daily life. So if you came home from grocery store, my suggestion would be, first thing you do is you wash your hand, you take off your mask and wash your hand again, and then you do other things at home. And the other important thing is, how do you clean and keep your home also safe from being contaminated? I would like to give you some tips in regards to that. In the hospital, we actually have certain protocol. We call it high frequently touched areas or objects. You can think that way at your home also and keep those high frequently touched objects clean. Examples would be your door knob. When you're coming, first thing you're doing is you're touching the door handle or door knob. Then you're going to the kitchen or bathroom or laundry room, touching the faucets. That's also highly touched area. You are also sometimes touching the television remote, or very frequently the switch that you are turning the light on. Those are the highly frequently touched surfaces or objects. I think it's a good idea to clean those handles and remotes and so on that I talked with some wipes or bleach soaked clothes and keep those clean. That way, if multiple people in the family are touching, they are not cross-contaminating each other. Now we talked about importance of sanitizing hands and washing hands and covering your cough and mouth using mask when you go outside. I'd like to show you how to properly sanitize and um, wash your hand. Obviously, I cannot show that, but it's the same method. So first, you have to know that what product you use. The hand sanitizer, just make sure when you look at the label, they have at least 60 to 65% or more alcohol in it. That's the minimum requirement. And if you have access to water and soap, you can do that as well. So the way you sanitize your hand is, obviously you take a fair amount of alcohol-based hand sanitizer, and then first you spread the alcohol in your hand and then go all over the surface like this. You have to do it for 20 seconds. Then you go between your fingers, all the surface between the fingers. After that, you have to take care of the fingertips by rubbing into your palm, both sides. And then finally, you take care of your thumb. So you do it for about 20 seconds. That's the proper way of sanitizing your hands. If you do use water and soap, you run the water, you take the soap, and same way you spread all over between the fingers, fingertips, and the thumb. And if you have paper towel, especially if you're outside in public places, then you take the paper towel, dry your hand with that, and shut the faucets with that paper towel without touching with your hand again. That's how you do your hand sanitizing and hand washing. And we talked about it, you just come home, first thing you do that. Anytime you touch some contaminated surface, you sanitize your hand. Also, if you cover your cough with a tissue or any other paper, so on, you have to sanitize your hands same way. That's important. In terms of mask, there are two types of mask, as you know, the medical mask, and now for general public, CDC and government has recommended that you consider wearing a regular homemade mask when you go out. We already talked about it, that this homemade mask like this is not designed to protect yourself to get the virus, but it is just to cover yourself so that in case you have the virus, you don't spread it to somebody else. Now, when you go outside and you come home again, make sure that you dispose this mask or take off this mask appropriately, because the mask on the outside again potentially could be contaminated. So you take off the mask by touching the thread or the loop instead of touching the surface. It's probably a good practice to wash. You can put it in a paper bag or in a small box before you use it again on the outside. It's possible, it's better that maybe you can wash it again. For medical mask, without going into details, it is not recommended for you to use it because obviously there's severe shortage. As a doctors and nurses, we are having difficulty in finding the surgical mask when we are taking care of the real COVID-19 sick patient. So I just want to mention there are a couple of instances where you may have to use a surgical mask. One would be if you are sick and you think, or doctor think you might have COVID-19 and you're asked to stay home. In that case, to protect your other family member, you should consider using a surgical mask at home at that time. Or if somebody else at home is sick with COVID-19 and they're home quarantined and you're somehow providing them some care, during that time, you can use a surgical mask for yourself to protect yourself from the virus, because these masks are designed to filtrate the viruses. So that's about the mask. The other question about gloves, whether you should wear gloves when you are going out, it is not recommended because there is higher risk of getting infection, contaminating the gloves, and not washing your hands, touching different things, because sometimes you feel like you have a protection through the gloves. It's not, and there is also a proper way of taking off the gloves. Many people would not be able to maintain that. So we have talked about a lot about the virus itself, the spread, the prevention. Now, unfortunately, what if someone develop a true infection? How do you know whether you have the infection? What are the symptoms and what to do? So with the pandemic going on, so many cases out in the community, most cases that coming to the hospital are considered COVID-19 infection if they have any respiratory infection at this time. So the common symptoms are fever. Most patients will have fever. They have low grade, sometimes 99, 100, 101 fevers, headache, body ache, cough. Usually they have non-productive cough, means they are dry cough. They don't bring up any phlegm. Some patients we are seeing also, they come with diarrhea and gastrointestinal, means stomach problems. And the other couple of things that many patients complain is generalized weakness. They feel very fatigued, tired, no energy, appetite is poor. Some cases they also complain that they don't smell anything, they lost their smell. So these are symptoms that actually can be seen in other respiratory infection too. But because we are seeing outbreak and most common infection we are seeing now is COVID-19 in Illinois, if you or anybody has those symptoms, should consider they might have COVID-19. Now, those are initial symptoms. After 5 to 7 days, some patient may develop then difficulty breathing, shortness of breath. When they walk or do something, they can have shortness of breath. Sometimes they feel chest pain. Those are some of the patient will progress to that. But a lot of patient actually will not progress to that. They will just feel like a viral symptoms like any other viruses. So what do you do if you have symptoms that concerns you? If you are otherwise healthy, you are less than 60 years old, and you have no other medical condition, it is most likely you will just get better and this will go away on its own. However, if anyone is more than 60 years old, or if they're young, less than 60, but they have high blood pressure, they have chronic kidney problem, or they have asthma or bronchitis, COPD, those kind of chronic lung condition, diabetes, even if they are young, they should be a little bit more extra cautious. In those cases, you should consider, if you have a primary care doctor, to call the doctor for direction, or in your area hospital there is hotline available. You can call those hotline and they can give you direction. And especially if you develop shortness of breath, means you're feeling like you cannot breathe, early on, not wait for several days. If your oxygen seems to be low, those are the time that you need to consider possibly going to the hospital by calling the hospital emergency department or hotline. I was given a couple of hotline number by Dr. Zafar Ahmed for North Shore area, in Evanston area where Dar-us-Sunnah community is mostly. And the number for North Shore University Hospital hotline is 847-432-5849. And the other hospital in those areas, Advocate Lutheran General, also has a hotline. That number is 1-866-443-2584. If you call that number, they will go through some questionnaire and may give you some guidance what to do. Now, in case if you develop symptom that could be COVID-19, as I said, everybody should consider they have COVID-19 if they have any symptom of respiratory infection, as I mentioned. Then what do you do at home? You have other family members, you need to protect them also. So that's where the home quarantine concept comes. That means you have to, if possible, have one completely separated room for yourself and hopefully, separate bathroom. I understand some family may not have separate bathroom, but what we talked early on means putting a surgical mask and frequently hand washing, avoiding and separating at least 6 feet from other family members, minimize interaction. If using the same bathroom, then maybe clean that bathroom with bleach and other chlorine product before and after use. Those few things can be done. But ideally, home quarantine means a separate room, separate plates and cups and glass, completely separate, covering mouth, not coming out of the room, using separate bathroom. That's ideal situation. If not ideal, at least you can still continue to practice some strict measures to minimize other family member exposure. In terms of test and treatment, not everybody at this point are being tested. People who are going to the hospital in the emergency department, they will be tested because of risks to other healthcare and as well as the community. The treatment at this point is primarily supportive. Many of you hear that we are sometimes using two-drug hydroxychloroquine and azithromycin. The data is limited. We are not using it in all patients. There's some side effect. I would not go into details, but know that the treatment is supportive at this time. Just taking care of the fever, temperature, and body ache with Tylenol, if needed in the hospital, oxygen, and maintaining electrolytes and other things are important thing at this time. We are almost at the end of our talk today. I would like to conclude today's talk with hope and some positive words as well as some cautionary words. As I said early on, that many patients will improve and get better without any bad outcome. We know about 80 to 82% of patients are getting better without any significant medical care even. So these patients sometimes can be managed at home. In last few weeks, we have discharged many patients from the hospital. Initially, they were sick. However, they improved. Some of them even did not require any oxygen at the time they went home. However, we need to be cautious and very careful as well. There are almost 10-12% of the patients who are severely sick in the hospital. They are requiring high oxygen. They're having other damage to their different parts of the organs, kidney, liver, and so on. And there are about 5% of the patients who are in critical care unit on artificial breathing machine, sometimes requiring dialysis for their kidney. And very small percentage, probably 2 to 3%, unfortunately, has died. So at this point, it is very important that we do what we are supposed to do, means do our own part. In your case, if you're not in emergency services, staying home is the most important thing you can do. First thing is do no harm. That's our religion teaches us to. So at this point, congregation prayer, gathering, all these things need to be avoided for the sake of human life and saving life. Our religion, Quran and prophetic tradition also teaches what to do in a situation like this. Allah said, Allah does not burden someone with something that he or she cannot bear. And also said in Quran, after each hardship there is ease. Verily, after each hardship there is ease. So we have to be optimistic and patient. Inna Allaha ma'as sabirin means we have to be patient. There is also teaching in prophetic tradition. Once someone told Prophet that he depends on Allah and let his camel just go like that. Then Prophet said, tie your camel and then depend on Allah. Means we have to do our part and then Allah will help us. Allah said, Allah does not help someone who doesn't help themselves. So there is reason to be optimistic. There is reason to be cautious. Stay home. Do your part. Tie your camel. Wash your hand. Cover your mouth. Cover your cough. Protect others. Do no harm. Protect your family. Protect your neighbors. All this will help us as well who are in healthcare field. With that, I conclude today. Jazakallahu khair. Assalamu alaikum warahmatullahi wabarakatuh.